The House Appropriations Subcommittee on Health and Human Services is called to order. Clerk, can you please take the roll?
Chair Morse.
Here.
Representative Martis.
Here.
Representative Hood. Representative Braybeck. Representative O'Neill. Representative Purry.
Here.
Representative Farhat.
Here.
Representative Price.
Here.
Representative Skaggs.
Here.
Representative Snyder.
Here.
Representative Green.
Present.
Representative Bolin.
Here.
Representative Meerman.
Here.
Representative Kuhn.
Here.
Representative Steele. Madam Chair, you have a quorum.
Thank you, Clerk. Welcome to what is a very exciting day and the culmination of a lot of work here for this committee. We are excited to be providing to you our first pass at the 2024 budget recommendations of the House. What our plan is we're going to have House Fiscal give a presentation, then I'll make some remarks. The Minority Vice Chair will be able to address you, and then we'll go through the rest of the process. So first, Martis moves to adopt the substitute, and I would ask the clerk to record the vote.
The question before the subcommittee is the adoption of the H1 substitute for House Bill 4310. Chair Morse, sorry.
Yes.
Going too fast. Vice Chair Martis.
Yes.
Representative Hood.
Yes.
Representative Braybeck. Representative O'Neill.
Yes.
Representative Purry.
Yes.
Representative Farhat.
Yes.
Representative Price.
Yes.
Representative Skaggs.
Yes.
Representative Snyder.
Yes.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Pass. Representative Steele.
Yes.
Madam Chair, the substitute is adopted.
Thank you, Clerk. So the first order of business is I'm going to welcome our House Fiscal Agency to lead us through the initial budget recommendation.
Can you hear me? Okay. Good afternoon, Madam Chair, members of the committee. My name is Sydney Brown. I'm from the House Fiscal Agency, and today I will be giving you a somewhat brief summary of the House Subcommittee Chair's recommendation for the fiscal year 24 budget for the Department of Health and Human Services. The summary document has been provided to you all at your seats, and that was what I will be using to go through. So the first thing I'm going to point at is on page 1. It is the fund sourcing table for the budget. For the fiscal year 2023-2024 House budget, the gross appropriation is $35.9 billion, with $6.6 billion being general fund. That is $2.5 billion increase from current year gross, and $346.1 million increase in general fund. Moving to page 2, item 4, we have the direct care wage increase. The executive includes $210.1 million gross, $74.5 million general fund. The House adds an additional $140 million gross, $24.8 million general fund, for a total appropriation of $350.1 million gross, $99.3 million general fund. This is to increase the per hour wage for direct care workers for $2.50 an hour for 1 year, as a dollar of that increase is given on a one-time basis. Moving to item 5 for long-term care non-clinical staff wage increase, the executive includes $90 million gross, $31.7 million general fund to increase non-clinical nursing facility staff hourly wages by $3.85. The House does not include this. Moving towards the bottom of page 2, we have item number 10, legal services. The House removes $12.3 million general fund from ongoing legal cost funding to recognize available funds currently available for legal services. Item 11 is lapse reductions. The House reduces multiple line items throughout the budget to recognize $6.8 million savings, and that is general fund. This was available from historical end-of-year lapses to the general fund. Moving to page 3, item 13. This is community services and outreach. This is the diaper assistance TANF swap. The executive includes $4.4 million general fund to replace the TANF that was allocated current year. The House decreases TANF funding by $2.9 million, which would leave $1.5 million for the program, and the program is then moved to the one-time unit. Item 14, the Crime Victims' Rights Sustaining Fund. The House deposits $60 million general fund into a newly established Crime Victims' Rights Sustaining Fund for the purpose of providing 3 years of funding to offset declines in federal crime or Victims of Crime Act funding and the Michigan Crime Victims' Rights Fund. Item 15, the Crime Victim Rights General Funding. The executive includes an increase of $7.9 million general fund for crime victims support programs. The House includes $20 million in state restricted funds from the newly created Crime Victims' Rights Sustaining Fund, which was mentioned above. And I should mention that I'm going over the major changes to the House budget, so it's a bit long, so. Page 4, item 21, in the Children's Services Unit. This is the foster family maintenance payment increase. The executive includes $19.3 million gross, $7.8 million general fund to fund an 8% increase to daily maintenance payments for foster parents, adoptive parents, and juvenile guardians. The House includes $12 million gross, $4.9 million general fund to fund a 5% increase to those daily maintenance payments. Item 22, foster care respite services. The executive includes $15.1 million general fund to implement a statewide foster care respite network. The House includes $13.9 million of that funding on a one-time basis to support short-term respite services and does not fund the creation of 6 specialized caregiver support contracts that was part of that original $15.1 million. Moving toward the bottom of page 4, court-operated facility construction, which is item number 25. The House includes $25 million general fund to construct a 32-bed court-operated facility in northern Michigan for youth involved in the juvenile court system. Moving to page 5, item 28, local office staff, adult protective services. The executive includes $6.3 million gross, $4.6 million general fund, and authorizes an additional 47 FTE positions for adult protective services. The House includes $1.6 million gross, $1.2 million general fund, and authorizes an additional 12 FTE positions. Item 30, public assistance coronavirus state fiscal recovery programs. The House includes $115 million in federal state fiscal recovery funds for 3 public assistance-related programs. That's $50 million for energy-related housing renovations, $25 million for pre-weatherization, and $40 million for water shutoff protection. Items 31 through 33, I'll say together. The House includes $34.4 million general fund as one-time funds for purchasing surplus agriculture products for distributions to food banks, grants to mitigate food deserts, and to train youth mentors through Big Brothers Big Sisters. Page 6, item number 35, Behavioral Health Accelerated Degree Program. The House includes 10 million federal coronavirus state fiscal recovery funds to provide grants to individuals who agree to enter into an accelerated social work degree program and work for at least 2 years within the public behavioral health sector after completion of their degree. Towards the bottom of page 6, item 40, Medicaid mental health local match. House includes $5 million general fund for the 4th year of phasing out the local match portion over a 5-year period. Moving to page 7, item 42, for the behavioral health one-time funding. The executive includes $13.6 million for multicultural integration and first responder mental health. The House concurs with those programs, but includes $64.2 million general fund for the following programs, and I'll mention a couple of the bigger programs. $9 million for the Certified Community Behavioral Health Clinic expansion, $8 million for the Inpatient Psychiatric Reimbursement Supplement, $5 million for Families Against Narcotics, $4.7 million for the Michigan Child Care Collaborative Program, also known as MC3. Toward the bottom of page 7, we have item 44, which is Healthy Homes expansion. The executive increases Healthy Homes funding by $22.5 million general fund and authorizes 45 FTE positions to support lead investigations and abatements and community-based testing, as well as expanded lab capacity and water distribution needs. The House increases Healthy Homes by a total of $18.8 million general fund, authorizes 21 FTE positions for lab capacity and data sharing. This amount includes $12.5 million general fund on the one-time basis. Item 45, drinking water projects. The executive includes $100 million general fund on a one-time basis to replace lead reducing filters, lead-containing faucets, and other plumbing in more than 1 million households. The House includes $20 million general fund on a one-time basis. Moving to page 8, item number 47, the Essential Local Public Health Services increase. The executive includes $30 million general fund to provide local health departments ongoing support for essential local public health services. The House includes $14 million to support an estimated 50% of the costs of essential local public health services. And that is general fund. Moving to item 49, perinatal quality collaboratives. The executive includes $10 million general fund and authorizes an additional 2 FTE positions for grants to local Michigan perinatal quality collaboratives. The House includes $5.5 million general fund on a one-time basis and does not include those FTEs. Moving to the bottom of page 8, item 52, this is the public health one-time funding. The House includes $27.9 million general funding for the following programs, and I'll just highlight a few. The $15 million for LGBTQ plus healthcare, and $5.5 million for the Michigan Breastfeeding Network for skilled lactation care. Moving over to page 9, item 58, hospital maternal health incentives within the health services unit. The executive includes $10 million general fund for hospital maternal health incentives through the Alliance for Innovation of Maternal Health. The House includes $5 million general fund on a one-time basis. Towards the bottom of page 9, item 62, Medicaid professional services rate increase. The executive includes $73.8 million gross, 19.7 general fund to increase Medicaid reimbursement rates by 10%. The House includes $36.9 million gross, 9.9 million general fund to increase rates by 5%. Moving to page 10, towards the bottom of page 10, item number 71, poison control. House adds $1.5 million general fund to the poison control program at Wayne State University. Then we'll move over to the top of page 11 for the health services one-time items. The House includes a total of $63.1 million general fund for the following programs, and I'll just name a few of the larger programs. $12 million for Level 1 and Level 2 trauma centers, $12 million for the Helen Newberry Joy Hospital renovations, $10 million for Mary Freebed Children Rehabilitation Center, $8 million for Corwell Psychiatric Graduate Medical Education, $7 million for the American Indian Health and Family Services, $6 million for the Health Center's Careers and Training Program. And this includes the Part 1 changes for the Chair's recommendation for the fiscal year 24 budget. And my colleagues and I are available if you have any questions.
Thank you so much, Sydney. I'm just going to ask everyone to hold their questions. I'm going to say a few comments. Minority Vice Chair will, and then we'll open it up to questions from the committee. So first of all, I have a huge round of thank yous to make. I can't thank our House Fiscal Agency enough. We are so lucky to have dedicated professionals that just have the history of these budgets and are nonpartisan. So they're just there to provide us the facts. And I can tell you that they spent many, many hours with us, and I'm grateful for their expertise. I'm just going to call out Victoria, Sydney, Kent, and Kevin. Thank you from the bottom of my heart. To our House Dem policy staff and Republican staff that joined us, Maya and Coffee Ann, again, grateful for your wisdom and your history and your knowledge of the things that we need to move forward. I'd like to thank my colleagues. Grateful for you all, your participation in this process, bringing questions, bringing your, asks for appropriations that are important to your community. This is a project that we all have to move forward together, and I appreciate you all. And of course, to my dedicated staff. Acacia and Connor, who we put through the system together first time on appropriations, and being chair of HHS is a very large and important responsibility. And I was able to rely on them to help us have a smooth process. So thank you guys so much. Just want to make a few comments on the whys. So as you all know in this room and whoever may be watching, this budget is critical to improving health outcomes statewide, ensuring we are protecting our most vulnerable people, especially children in the child welfare and juvenile justice system, and expanding access to our behavioral health system. In the course of working through this budget, we've heard from many organizations and individuals across the state who are either engaged in providing the services we offer or recipient of the services we provide. We've engaged with our colleagues on this committee, heard requests from other members and the public in large in public comment. We've worked many hours with House Fiscal and House Policy to craft a budget that invests in the areas that are most needed in a sustainable way. We hope everyone can understand that we made careful consideration regarding every request, and the work of this committee will continue even after the budget is completed. To those ends, this budget invests in every part of the state, from a critical access hospital in the UP to a substance use disorder clinic in Berrien County, to OB services in the Thumb, to health disparity reduction community clinics in Detroit, to crisis access beds in Owasso. The budget acknowledges that every community has unique needs, and this budget works to address. This budget values our direct care workers, the need for more behavioral health providers, the work our counties do in public health and child welfare, and the mothers across the state who are birthing our future generations. Some highlights that were important to me that I just would like to mention include, in the behavioral health area, the recruitment and retention for behavioral health provider program, the accelerated degree program, CCBHC expansions, the Memorial Healthcare Crisis Unit, a variety of substance use disorder programs, and mental health provision for our first responders. In maternal and infant health, we have the Perinatal Quality Collaborative, the Michigan Breastfeeding Network. We have eliminating the 5-year waiting period for Medicaid for pregnant women. We have centering pregnancy, and we have hospital maternal health incentives, among other items. In the child welfare system, we've appropriated 75% to the child care fund, bringing it up from 50% as requested by the task force. We've increased the foster family payment. We've invested, or we would like to invest in the foster family respite services, as well as the court-appointed special advocates to make sure all of our children are well protected in court. Finally, in public health and community health, we have our Crime Victim Sustaining Fund, our Michigan Agricultural Surplus System, which takes advantage of the agricultural systems we have here in Michigan, and our farmers providing healthy, nutritious food to people at food banks. We have money for food deserts, healthy homes, drinking water projects, and much more. This budget represents our values, and I, at this point, am really grateful that the state is in a good financial place so that we can invest in many of these areas. That being said, there are many, many needs across the state in health and human services, and we can't say yes to everything, and we can't fully fund everything. But believe me when I say, we know every need is there, and we will be continuing to pay attention to the needs. We will continue to work in this committee and make sure we are providing as much accessible and affordable health care as we can. And with that, I will give my Minority Vice Chair, Rep. Green, a moment to share some comments.
Thank you, Madam Chair. Thank you to, there's obviously many people putting this budget together, working behind the scenes in ways that many people don't even realize, from our individual staff members on in our office to House Fiscal, and getting a whole list of amendments last night about 10 o'clock, and then being here with a smile on your face. Thank you, Kevin. Thank you to our Republican staff that worked with me, even though we had a transition and one guy ditched us. We now have Chris Jones, and I appreciate the work he put on it. And then, of course, thank you to the chair. You've been a pleasure to work with. You've been available for discussions even on Thursday nights as we are on our way out the door and end up in an hour-long discussion. I recognize the incredible amount of work this budget required. To many, this may come as a surprise, but while we didn't see eye to eye on every issue in this budget, I know this budget is the first huge step in crafting our state's budget, and the work will continue. I would like to highlight the areas that I truly am excited about. The emphasis on behavioral health, and specifically substance abuse, and the way we're looking to address that, as we know that substance abuse really destroys individuals, destroys the families, and destroys the communities surrounding it. And as well, inside behavioral health, the training of new professionals, and that is exciting for me. I love to see the funding for our state psychiatric hospitals. That's a big part of what I've been working on for 4 years, and as well as the funding for children's services, including the foster care respite and the court-appointed special advocates, looking at what our children go through and the needs they have. And then as well, another thing very near and dear to me is the care for our brain injured through the brain injury service provider lines. And those things have just, I'm very excited about. Chair, it's been a joy working with you, and I know it's going to continue as long as we're in this session and we're both in the House, unless, anyway, I won't go there about getting removed. But Chair, it's been a joy, and thank you.
Thank you, Rep. Green. The feeling is mutual. At this point, we'll open it up to questions from members of the committee. Rep. Farhat.
Thank you, Chair. I just wanted to echo those sentiments, and again, thank you for your leadership on this committee, and thank Coffee Ann for really just putting together what I think is a remarkable budget that reflects the values of our state. You know, I only have one very small question. For the 5-year waiting period, there's a small asterisk. Not asterisk, there's a small, where it says something about federal dollars. This is a revenue neutral move by eliminating it, correct? Which number? It is number, 1 second. The 5-year waiting period.
I think that was...
Yeah, to answer that question, this was a technical cost estimate adjustment that was worked with in concert with the state budget office. So there was some financing, cost sharing between traditional Medicaid and Healthy Michigan Plan. And so this just kind of corrects that amount. So there is no policy change or policy impact to this proposal.
Awesome, yeah, I love to see that in the budget, so I just wanted to make sure it's a really smart move, I think, to just make Michigan more of a healthy environment, just keep it, our state healthy, so I just wanted to make sure. Thank you.
Okay, seeing no further questions, now is the time for any amendments to be offered. So if you have an amendment, please go ahead and make your motion. Rep. Steele.
Thank you, Madam Chair. I move my amendment of a $100 placeholder for Common Ground, a mental health facility in Oakland County. And I toured the facility. It's an excellent mental wellness facility in Oakland County when it's especially needed. Thank you.
Thank you. Any discussion on that proposed amendment? I'm just going to indicate that at this time I am going to pass, and then but go ahead and ask. Go ahead, clerk, and call the vote.
The question before the subcommittee is the adoption of the Representative Steele amendment. Chair Morse.
Pass.
Vice Chair Martis.
Pass.
Representative Hood.
Pass.
Representative Brayback.
Pass.
Representative O'Neill.
Pass.
Representative Puri.
Pass.
Representative Farhat.
Pass.
Representative Price.
Pass.
Representative Skaggs.
No.
Representative Snyder.
Pass.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Rep. Green.
Thank you, Madam Chair. My amendment looks at part of the psychiatric issue that we have with our psychiatric hospitals, make sure we need more beds. And this amendment would help put a 12-bed facility in the Thumb area specifically for geriatric psychiatric. I so move my motion.
Thank you, Rep. Green. Is there any discussion? Well, I'm just going to add that I am going to pass, and while I appreciate this, I would like this to be, we can continue discussing this and figuring out where we do need to add additional beds. Clerk, will you please take the roll?
Question before the subcommittee is the adoption of the Green Amendment. Chair Morse.
Pass.
Vice Chair Martis.
Pass.
Representative Hood.
Pass.
Representative Brayback. Representative O'Neill.
Pass.
Representative Puri.
Pass.
Representative Farhat.
Pass.
Representative Price.
Pass.
Representative Skaggs.
Pass.
Representative Snyder.
Pass.
Vice Chair Green.
Yes.
Representative Bolin.
Yes.
Representative Meerman.
Yes.
Representative Kuhn.
Yes.
Representative Steele.
Yes.
Madam Chair.
Thank you, Clerk. Rep. Bolin.
Thank you, Madam Chair, and I would like to echo the comments made by the Vice Chair. Thank you very much for your work and the collaboration, especially the working groups. I think that they were very beneficial and certainly work towards addressing the needs in our state. I offer this amendment today to ensure that the programs that we do establish are providing the results that we actually expect. Recently, we appropriated a lot of money to support working families and businesses across our state by providing for a daycare subsidy to help fill our workforce shortages. DHH's S's role was to determine the eligibility, provide notifications, and sign off so daycare providers can be paid. Parents are required to commit to the daycare hours in advance, and so that the provider can properly plan for staff and resources. Without the subsidy, many people in Michigan cannot afford the care for their children. Recent reports indicate that determinations or redeterminations lagged by the department, resulting in parents committing to time slots that they cannot afford to pay and have left many of our small business and daycare operators left unpaid. A Detroit Free Press report over the weekend highlighted several instances of this occurring. We need to rectify this, and therefore this amendment is being offered, requiring a report so that we can understand why the system failed these families and help us to better plan for the universal pre-K programs that the administration has also proposed. Madam Chair, I move my amendment.
Thank you, Rep. Bolin. Is there any discussion or questions? No, and for this one, thank you, Rep. Bolin, for bringing this to our attention. I'm going to pass on this today, but this is something I think that we need to give some attention to and certainly look into what's happening, and we will continue to look at this issue. Clerk, please take the roll.
The question before the subcommittee is the adoption of the Bolin Amendment. Chair Morse,
Pass.
Vice Chair Martis,
Pass.
Representative Hood, Representative Braybeck, Representative O'Neill, Representative Curry, Representative Farhat,
Pass.
Representative Price,
Pass.
Representative Skaggs,
Yes.
Representative Snyder,
Pass.
Vice Chair Green,
Yes.
Representative Bolin,
Yes.
Representative Meerman,
Yes.
Representative Kuhn,
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, Clerk. Rep. Green?
Yeah, thank you, Madam Chair. Over the course of time, there are different drugs, prescription medications that come into being, and we have a very real issue in our society with drug overdoses. And my amendment places a $100 placeholder that would give us an opportunity to discuss the availability of a new drug that is an opioid reversal medication. I would ask that we consider placing this in a $100 placeholder so that discussions can continue as to how we can aid our communities in reversing drug overdoses. I so move my amendment.
Thank you, Rep. Green. Any comments or questions? Okay, for this one, I just want to let you know my reasoning behind this. I'll be voting no because I did reach out to the department to ask about this. There have been a couple of different pharmaceutical companies that have asked this question about why we only have one drug. Well, at the time the state entered into a contract, there was only one drug for opioid reversal. So the department will be creating a new contract next year for that Narcan type products. And so we'll make sure to connect with them and have this discussion about if we're going to open it up to other pharmaceutical companies. Clerk, please take the roll.
The question before the subcommittee is the adoption of the Green Amendment. Chair Morse,
No.
Vice Chair Martis,
No.
Representative Hood, Representative Braybeck, Representative O'Neill,
No.
Representative Curry,
No.
Representative Farhat,
Pass.
Representative Price,
No.
Representative Skaggs,
Pass.
Representative Snyder,
Pass.
Vice Chair Green,
Yes.
Representative Bolin,
Yes.
Representative Meerman,
Yes.
Representative Kuhn,
Yes.
Representative Steele.
Yes.
Madam Chair, the amendment is not adopted.
Thank you, Clerk. Our next amendment, Rep. Steele.
Thank you, Madam Chair. I would like to move to amend page 5, line 5, after 10, by striking out $41 $2,597,900 and inserting $43,597,900 and adjusting the subtotals and Section 201 accordingly. Amend page 67 following line 28 by inserting Section 532 from the funds appropriated in Part 1 for adoption supporting services. The department shall allocate $2 million to fund a tax credit to adoptive parents. The department shall coordinate with the Department of Treasury to ensure timely processing and issuance of tax credits to adoptive parents. Thank you.
Thank you, Rep. Steele. Any discussion on the proposed amendment? Clerk, please take the roll.
Question for the subcommittee is the adoption of the Steele Amendment. Chair Morse?
No.
Vice Chair Martis?
No.
Representative Hood? Representative Braybeck? Representative O'Neill?
No.
Representative Puri?
No.
Representative Farhat?
No.
Representative Price?
No.
Representative Skaggs?
No.
Representative Snyder?
Pass.
Vice Chair Green?
Yes.
Representative Bolin?
Yes.
Representative Meerman?
Yes.
Representative Kuhn?
Yes.
Representative Steele?
Yes.
Madam Chair, the amendment is not adopted.
Thank you, Clerk. And finally, Rep. Kuhn.
Thank you, Madam Chair. Assisted outpatient treatment is a legal mechanism that enables individuals with severe mental illness who are not willing or able to comply with treatment to receive court-ordered care in the community. A 2018 study published in the Psychiatric Services Journal found that individuals who received assisted outpatient treatment were 45% less likely to be rehospitalized than those who did not receive assisted outpatient treatment. Assisted outpatient treatment has been found to be cost-effective because it reduces the use of costly emergency services such as hospitalizations and incarcerations. According to the Treatment Advocacy Center, the average cost of a day of assisted outpatient treatment is $77 compared to $1,000 for a day in the hospital and $2,000 for a day in jail. Investing in a Navigator program offers better outcomes while saving taxpayer money over the long run. This is a win-win proposal for our families and especially for our underserved, struggling young people. I move the amendment.
Thank you, Rep. Kuhn. Is there any discussion? This is another one. I very much appreciate Rep. Kuhn bringing this forward. At this time, I'm going to pass, but I do believe that these funding ideas could continue to be a part of the conversation, again, as we assess our behavioral health resources across the state and, you know, the places we should add resources that are going to work for our communities. So with that, Clerk, please take the roll.
The question before the subcommittee is the adoption of the Kuhn Amendment. Chair Morse?
Pass.
Vice Chair Martis?
Pass.
Representative Hood? Representative Braybeck? Representative O'Neill?
Pass.
Representative Puri?
Yes.
Representative Farhat?
Pass.
Representative Price?
Pass.
Representative Skaggs?
Pass.
Representative Snyder?
Pass.
Vice Chair Green?
Yes.
Representative Bolin?
Yes.
Representative Meerman?
Yes.
Representative Kuhn?
Yes.
Representative Steele?
Yes.
Madam Chair, the amendment is not adopted.
Okay, thank you, Clerk. Thank you, members of the committee, for your amendments. We are going to give you, the members of the committee, one last time to offer any comments or questions. Rep. Steele?
Thank you, Madam Chair. I appreciate allowing a comment, and it just kind of will summarize my vote for the total budget. And being new, I had hoped that this process would have been a little bit more transparent from the beginning to the end. So I would just like to make a comment saying that the budget increasing $2.5 billion from $33 billion to $35 billion is quite extraordinary, and especially when this budget is 50% of the total budget for the Michigan budget that we're going to adopt shortly. I thought that the process, the oversight, and the transparency of the programs is dismal, and I had hoped that this budget process in these open forums at these committee hearings would have been different and more transparent, and that will be the result of my vote. Thank you.
Thank you, Rep. Steele. I would just note, I hear you, and believe me, going forward, we can look at other ways about how we can try to improve the process so that you feel has transparency. Rep. Martis?
Thank you, Madam Chair. Just wanted to echo the sentiments of my colleagues. Thank you to our wonderful staff, our wonderful advisors, and our wonderful colleagues that have really come together to, as the chairwoman said, build a budget that represents our values. Also just wanted to congratulate our chairwoman on really building such an amazing budget. I am a proud member of the Morse Force. I thought that this process would go pretty well. I think it exceeded expectations. We got a lot of wins for the projects that will do a lot for our communities and our districts, will do a lot for the state of Michigan, and just really proud to play a role in that process.
Okay, well, my closing remark is going to be thank you so much. And this process still has a ways to go. And I'm excited, though, to continue the work and continue the discussion so that we really can make the best investments in the health and human services areas for the people of the state of Michigan. Rep. Martis moves to report House Bill 4310 with recommendation of approval. Clerk, please take the roll.
The question before the subcommittee is to report House Bill 4310, substitute H1 with recommendation that it pass. Chair Morse?
Yes.
Vice Chair Martis?
Yes.
Representative Hood?
Yes.
Representative Braybeck?
Yes.
Representative O'Neill?
Yes.
Representative Purry?
Yes.
Representative Farhat?
Yes.
Representative Price?
Yes.
Representative Skaggs?
Yes.
Representative Snyder?
Yes.
Vice Chair Green?
Pass.
Representative Bolin?
Yes.
Representative Meerman?
No.
Representative Kuhn?
No.
Representative Steele?
No.
Madam Chair, the House Bill 4310, substitute H1 is reported with recommendation.
Thank you very much, Clerk. One last thank you to the whole team. And with that, seeing no further business, this meeting is adjourned.